You're listening to Living with Louie. Welcome back to this edition of Living with Louie. We have a guest on our show today. I have with me one of the members of my therapy team, Mandy McFadden. Welcome, Mandy.
Thank you, Larry. It's good to be here.
So Mandy, why don't you go ahead and tell them just a little bit about yourself?
So, I am an occupational therapist. I've been an OT for the last 4 years. I received my master's degree at Towson University. Before that, I was an exercise science major. I did a little bit with personal training, and I was a massage therapist for 17 years prior to that. So, I have a lot of experience with body movement, function, strengthening, and more recently, since I've an OT, neurological conditions and strengthening as far as that goes too.
Well, I know that you have been a tremendous help to me. I don't know where I would be had I not gotten involved with you and the rest of the team. Maybe you can talk about how we kind of started and what you saw and some of the things that you did to progress to getting me to where I am now.
Absolutely. So when we first came out, I guess it's been close to 10 months ago now. Um, as an OT, it's my job to assess function in the home, make sure that with your self care, you're managing that as safely and independently as possible. So we looked at bathing, dressing, toileting, accessing the bathroom safely, making sure that anything you needed to do around the house was set up the way that you needed to. So my job when we first came out was to assess the environment and how you functioned in that environment. The next step was looking at how your strength was, especially in your arms. With physical therapy and occupational therapy, when we're working together as a team, physical therapist tends to take over lower body, spine, that type of thing, and OT tends to deal a little bit more with arm strength, hand strength, dexterity, fine motor skills, and those kinds of components. So when we first came out, you were very independent as far as wanting to continue doing everything that you needed to do on your own. With your self care, you were managing it okay, but definitely noticed some things you were struggling with. The big thing was the dexterity in your hands. You were having a hard time managing buttons and fasteners, some of the containers in the kitchen, opening things to be able to get into it easier. The frustration levels, I think, were a big thing to start. When the hands weren't working the way that you wanted them to, being able to get in a good headspace to be able to problem solve through that was a little bit challenging to start. Um, and then the other thing we really noticed was you had a lot of pain in the hands and a lot of weakness in the hands and the shoulders, which I think has improved over time. But I know you still definitely have some difficulties with the swelling in your hands and the dexterity and hanging on to things and your fingers working the way that you want them to. And a lot of what we've been doing lately has been really geared towards your balance, making sure that we keep your legs strong and keep your coordination the way that it needs to be. So we've kind of hit you from all angles. And I know that you were struggling mentally with a lot of things when we first came out too. And I think that since we've shown you what type of progress we can make and made some improvements and function that way.
I think
um,
mentally, if I may, I think mentally, when you first came out, I didn't feel as though there were too many things that were going to prevent the rapid progression of this disease. And I think that what you guys have shown me is that there's a battlefront that I can have success with.
mhm.
And I, I think that it's shown me that there is a way to beat back this disease.
Yep, absolutely. And I, unfortunately, and I've heard you talk about on other episodes of your podcast before, just the lack of information that's available, especially positive information that's available, is it's significant. And what we know from working with neurological conditions all the time, I mean, there's no cure for it. We're not going to stop it from happening, but we can at least slow it down. We can improve function through that. And the brain is an amazing thing. And there's so many times over and over again that we see people that feel like you're not going to get any better. You're not going to make any progress. Nothing's going to change. And we can find ways to make it happen in a way that's meaningful and that matters in your day to day.
It's, I think, quality of life gets greatly improved given the diagnosis, given all of the things that are taken from you. I think that you've given me a way to get some of that back as much as I can get back. From a physical standpoint, like you said, mentally, I don't think there's anything you can do with that portion of this disease.
Mm.
Certainly, you've made a tremendous difference in how I walk, the amount of security I have in my with my balance. So I think those are big areas that you've made a difference in. And you made a lot of suggestions here to modify my home with grab bars and timers for the hot plate that I would occasionally leave on. And there's a number of things that you've done that certainly made it a lot easier for me.
Well, I'm glad. And the way that we tend to see, with occupational therapy, I feel in a lot of ways, some people would come out as a therapist, make sure that you're independent, and you are, you're independent with everything that you need to be, and look at that and say that's good enough. Um, and knowing that your balance can impact your ability to do those things. And if you don't maintain that balance or that coordination, then everything else in your life is going to suffer. So I think it's important to make sure that as an occupational therapist, we look at the whole picture and not just, okay, you can put your shirt on and take it off. You're fine. You can get in the shower safely. You're fine. All these other components that are needed to maintain that function, I think, are extremely important.
I know that you've come up with all kinds of exercises that when you first asked me to do them, I'm like, what? But I cannot argue with the results. And I think that a big piece of the success is the fact that, and I've talked about this in my podcast, as is willingness to get up and do it.
100%. And the way that we do these exercises, we've kind of come up with a combination of exercises that's very challenging and they're not easy. And I know that a lot of the times you don't, really feel up to doing them, or if you're sore or you're having a bad day. But the hallmark, you talked about it in one of your other episodes too, about the neuroplasticity of the brain and how we have the ability to kind of reconnect those pathways that have been damaged by the Lewy body proteins. And the way that we do that is by doing those challenging exercises that incorporate your cognition and your motor movements and your full body movement. So it really is a full body experience, and a lot of the times it's uncomfortable and it's very difficult and challenging, but if it's not challenging, it's not working.
Right? It's not you can't get any improvement without challenging. And I I think you know this about me is, yeah, maybe I don't feel like it, or but I throw that aside and give it everything that I can because I have bought into, um, and there's no disputing the results that we've been getting. Uh, so I don't understand why you wouldn't want to do it.
Yeah, and I completely agree. I mean, I with even through your bad days, you are an absolute model patient. We don't always know what to expect when we come in, but I do know that whatever you're
Be
going
careful.
through,
I don't want my head to get too big.
regardless of what you're going through, I know that you're going to step up and show up every session.
Yes, I will, and I think that is a commitment that I made. Maybe not the first couple of times that you guys were out, but it didn't take very long before I knew um, that things were going to improve, and bought into the program and said, okay, and if this is the only battle I can win, then I guess need to bring something besides a rubber band gun. I need to bring grenades and uh, and really launch a battle against this disease
Mm,
because it is progressive, and I think we have slowing down the progression.
mm,
Um, so the other thing that I find very interesting is that regardless of what the problem is, if I'm having a particular problem, you don't come in and drive an agenda that's preset.
mm,
Come in and address the problem.
mm. Yep, and I think that's an important part about any clinician or therapist working with someone. I mean, we can have a huge laundry list of the things that, we feel like we should work on. But when we come out, if you're having a bad day or, you're hurting somewhere, I mean, at the end of the day, until we address that, nothing else that we do is going to be, you're not going to be able to put your full effort or energy into it because we need to get that taken care of, whatever it is. And I think that that individuality to treatment and really kind of putting you first and your needs first makes the biggest difference because more than anyone that's working with you, you know your body, you know what you need. We can guide you and direct you in that. But if we're not listening to you and your thoughts and your feelings and what you're going through, it's a two-way street, and if it's just us and our opinions and our thoughts on what's going on, it's not going to work. It's a huge collaborated effort.
I I know that I'm one of the younger people that you've seen with this disease.
Mm,
Also, I think what's considered to be maybe at um, earlier stage of the progression of the disease. And you can correct me if I'm wrong, but it's seems like it's a learning experience for you guys, and it's certainly one for me.
mm, yep.
I know that uh, you guys have done your homework and your research to make sure that you're bringing the best that you can bring uh, to the table.
Mm. And I feel like that's very important too. The lack of information that's out there for people that are suffering with Lewy body. It's just the same. There's not a ton of information on the back end. I mean, we can find certain things, but a lot of the times as a therapist, we're looking for specific interventions, specific treatment plans. What can we implement that we're going to see progress? And some of it's just up in the air. There's some research that's been done, but there's not a lot to support one thing or another. So a lot of it's trial and error. We try to figure out what works. But definitely your ability to kind of articulate those things to us, and what you're feeling is working is super beneficial.
I think that you just hit on something that I've you can speak to this, but I feel as though I'm very in tune with what's happening with me.
Mm,
I think that began when I survived cancer. I was understanding what was happening with my body and being able to convey that to my medical team. And I think that translates right over to this, that you have to be able to at least try to describe to you the best that we can what's happening.
mm. Yep. And if you don't mind me kind of touching on some of the freezing episodes
I don't
that you
mind at
have.
all
Um,
because what we're talking about is living with Louie, and that
mhm.
is part of.
Yep. So initially, when the freezing episodes were not happening, so by freezing episodes, I mean where you sort of kind of zone out, you kind of get these jerky body movements, get really unsteady on your feet, and have some balance loss. Um, and you can just tell like your cognitive piece is just your head is swimming
You're
from
gone.
what you kind of described to me. And in those moments, from what we are physically seeing on the outside, it's kind of like you're just kind of there, your body's doing some stuff, and you're just in space, and we don't know what's happening when that happens. And your ability to kind of tell us, I feel like my head is swimming, I'm feeling a little lightheaded, I feel unsteady, or when we were noticing some of that, like what we call the autonomic dysfunction, where you break out into sweats for really no reason when your heart rate's all over the place. Your ability to be able to say, I feel like my heart is racing. I don't really feel like anything's going on, but this is physically what we're seeing. And it kind of helps us put together the pieces of a puzzle so that we know what to do moving forward. Is it a medical emergency? Do we need to contact the doctor? Or is it something that's just going to pass? It's just part of this disease process. And it gives us some peace of mind knowing that we can kind of communicate back and forth with each other, and you're receptive to what we have to say, and we're receptive to what you're telling us. And it just goes back down to working as a team to kind of get through it.
Well, I know that you guys work together as a team because, as I have said before to you, that you'll say, "Well, how were things yesterday?" And I'm like, "You already know the answer to that question because you've already had communication with your teammate." And yeah,
Yeah. If you're having a bad day, we call them when we leave the driveway. Hey, just to let you know, Larry's kind of having an off day. This happened. And so she knows what to do walking in. And to be completely honest, on the same side, I've had similar conversations come to me. And I'm like, okay, well, if this is going on, I know what we're going to go dress when I go in there, you know?
well, I can't argue with the success in it, and I think that if there's anything that I can help people to understand is that laying down and just, if you will, wallow, I guess, in your diagnosis, you're that's where you're going to be. And I think the progression of it is going to happen much more rapidly.
That's exactly right.
And so getting up, getting moving, and participating in what you guys are trying to help me to achieve is important. And so, if nothing else, I would encourage people to get up, get moving, and get involved in some type of size plan. And I know that you guys have tried things with me that um, pretty much are from Parkinson's treatment.
Yep.
But you're addressing the Parkinsonisms of the Lewy body, and that's, I think, where those larger movement things you were talking to me about it earlier.
Yep, that's exactly right. So, with the Parkinsonism, the components of Lewy body that mimic Parkinson's, you tend to get the walking on your toes, shuffling your feet when you walk, having that balance and coordination problems. A lot of the times when you see patients with Parkinson's, over time, everything tends to get smaller. Your movements get smaller, your steps get smaller. The way that you can move your body, extend your arm, all of that movement kind of decreases. So with those big movements, it's big steps, big arm swings, big arm movements. There's a speech component to it that causes, for you to verbalize loud, you know, projection of your voice. And all of that does is just try to counteract all of that small kind of tendencies of a Parkinson like symptom. And that's a lot of what we do. With Lewy body, we understand kind of, it's protein plaques in the brain, and those plaques are going to chemically change the brain that affect the way that you move and the way that you think. But we don't really know what's going on in the brain. We just know what we see physically. And a lot of what we do is just combat the symptoms that we see, whatever they are.
Well, you've done an effective job. That's all I'm going. I mean, there's just no arguing with where I was, where I am, uh, and I can't thank you enough.
That's my pleasure. And I'm glad that it's working for you. And for people that have a therapy team that are working on things and it might not be working for them, just like anything else, it's not one size fits all. There's ways to adapt and modify and continue to push forward. So my suggestion would be to those who have worked with a therapy team and they haven't been successful, or they haven't, liked the outcome of it, or really weren't seeing much of a difference, keep looking. It's just like anything else. There's, dozens of therapists that are out there that can help. And sometimes you just got to find the right fit.
Well, I certainly feel like I have the A team. I think all of you specialize in one way or another in neurological disorders, and that is obvious with what you able. And it's been so far, it's been a great experience. I don't expect that to change.
Good. And it's been a wonderful experience. I know for all of your therapy team, and just being able to share the journey with you and learn just as much as you're learning. And it's invaluable information that I'll be able to carry with me my entire career.
I think it might have been Allison who said to me that when you guys are learning and I'm learning, that's when you know that you're having effective therapy. If you don't
Right.
have that component, then it's not going to work.
Mhm. Yep, there has to be open communication and open mindedness on both sides.
With that, I'm going to close my mind. Just kidding. It doesn't take much with this disease for your mind to take a mental vacation,
Right.
but that is Lewy body. Well, thank you for sharing some of your time with us
No, I
today.
appreciate you having me on.
Well, and certainly if you'd like to come back and discuss more, I'm sure that that would be quite welcome. Thank you. We'd like to thank you for joining us for this edition of Living with Louie.